Healthcare is way better overseas than in the US, and people have literally been leaving the country in droves to seek and receive better treatment than they are getting in the US. Due to the rising cost of healthcare and health insurance, the poor quality of medical treatment that you may receive here, and medical providers at times treating you like you're the problem and you're the ones who's bothering them. It's no wonder that people have been leaving the country in search of better treatment abroad. Let's hear some of their stories.
Okay, you guys, I'm never going back to the American healthcare system after this experience, and you won't believe how much it cost. And hi, if you're new here, my name's Kara. I'm the digital nomad mom, and my family and I sold everything we had to travel the world full time. And today we're getting a checkup at the Memorial Hospital in Istanbul, Turkey. We got a standard checkup for all of us, which included blood testing of our cholesterol, blood count, triglyceride, an EKG, chest x-ray, full urine analysis, and abdominal ultrasound. And for our daughter's pediatric checkup, she received full blood testing along with pediatric, ophthalmology, and ENT examinations. The package also included VIP transfers to and from our hotel, an English translator who accompanied us throughout the day to all of our appointments, a complimentary meal in their restaurant, which was so good, and all testing results translated for us to take home. So for all of this, it cost our family of 3 just $1,300. Turkey is seriously becoming the health tourism capital of the world, and if you have medical or dental needs you've been putting off because of the cost, book you a flight to Turkey and get it done here. The cost is so much less, you'll be cared for, and you can enjoy an incredible vacation.
So I'm pretty sure I have a sore throat, so let's go experience the Brazilian medical system. Oh, God.
Getting sick in a foreign country is never ideal, but if it had to happen, I'm actually glad it wasn't Brazil because getting help was so easy. My friend directed me to the closest public health clinic where I showed up without an appointment and used my broken Portuguese to tell them my problem.
Eu tenho dor de garganta muito forte.
My Portuguese has definitely since improved, but that's besides the point. Within 2 hours, I saw the doctor, did some tests, got a prescription, and was sent to the on-site pharmacy where they gave me a week's worth of antibiotics and ibuprofen. And when all was said and done, I had to ask.
Pagar?
No, I got it. No.
Muito diferente en mi país. This is the second time that I have been treated abroad and did not have to pay anything. First time was in London, actually in Liverpool. And the second time is here. And I'm like, you really mean to tell me that the United States cannot afford healthcare? Fucking ridiculous. Pisses me off every time.
Have you ever thought about getting a comprehensive health check abroad? I recently did in Japan, and it was way more than just a standard physical that we get in the US. It was hands down the best medical experience I've ever had, and it was super affordable, easy, and efficient. I chose the Kamita Kyobashi Clinic for its reviews and convenient location in Tokyo. And they have 3 different health panels that you can choose from, and I chose the middle tier, Ladies Significant, which was about 20 different medical tests that I got to do over the course of a day. A couple of weeks beforehand, I was sent a packet to fill out with my medical history and an explanation of what to expect. On the day of testing, I met my lovely English interpreter who was with me the entire day and who guided me throughout the entire process. Some of the tests I had done included a chest x-ray, hearing test, an ECG, lung function. I also opted for a vascular age test because of my family history of heart disease. Everything took 5 hours total, and at the end of the day, I met with a doctor who reviewed the preliminary results. I was astounded by how efficient the process was and how generous the doctor was with his time in answering my questions. Everything was $1,400 total, which is a steal if you compare it to the United States. Y'all, if Japan was closer, I would do this every year.
I took my parents to Turkey for full-body longevity checkups because I want my mom and dad to live forever. Doing this in the US would have bankrupted me and been impossible to schedule, but in 3 days, we're doing it all. Genetic testing, full-body MRIs, dozens of scans and tests. They've never seen anything like this in the US, and the price in Turkey is jaw-dropping. We were met at the hospital by our incredible translators, which are included in the checkup price, and kicked things off with 47 labs, 4 cancer marker tests, and a hereditary cancer panel that screens 140 plus genes for inherited cancer risk. They've never been filmed with the doctors before, and we're hamming it up. They have a breakfast spread so you can eat after your labs. Then they met with an internal medicine doctor to review symptoms, questions, and health concerns. Now we're off to radiology for a mammogram, thyroid ultrasound, breast ultrasound, and full-body MRIs. Dad's request was just don't film up my dress. In America, my parents' health insurance costs $22,000 a year, and they still don't get access to testing like this. Next was dermatology for a skin cancer screening, then cardiology for an examination, ECG, and stress test. This is the newest location of the same Memorial Hospital where Cody and I got our checkups last year. By the end of day one, my parents were blown away. Day 2 started with a dental exam and x-rays, then urology, gynecology. They did a bone density scan, met with a general surgeon and the ophthalmologist where they both walked away with a new glasses prescription. We ended the day with gastroenterology, where they did a colonoscopy, upper endoscopy, and colon and stomach biopsy. Whew, big day. Last, you meet with internal medicine again to review results, what to monitor, and next steps. We chose the longevity checkup package, and all of these tests, scans, and specialist appointments, including translators, cost $5,500 per person. Back home, my parents were just billed $9,000 for a single wrist MRI, so we'd never get to do something like this in America.
Come with me to Bangkok to try out medical tourism with a full workup. And by full, I mean full. Starting off, we signed my life away, grabbed some vitals, and immediately went next door for some blood work. Needle trigger warning, but we tested for cancer markers, inflammation, cholesterol, the works. She immediately took me next door to go ahead and change into this sweet outfit, handed me a cup for both stool and urine. We started off with a fibro scan to measure stiffness and fat in the liver. This helps screen for fibrosis or fatty liver changes. Right next door was the CT scan. The scans took about 10 minutes and looked for early lung changes and abdominal fat around the organs linked to metabolic risk. Next was the brain MRI and MRA, which assessed the brain's structure and blood flow. This took about 40 minutes. Then moved to the heart with an EKG, echo, and arterial stiffness scan to assess rhythm, structure, and vessel health. Now with the echo and the stress test, the cardiologist was amazing, but do not be fooled. I was definitely sweating when it came to the stress test. And no, I did not record myself running because nobody needs to see that. Next up was the pap smear, and yes, they did give me crotchless pants to wear for it. Feet up in the stirrups, that one definitely made me laugh. We moved right into the eye exam and then hearing exam, which I don't think I've done since elementary school. Thankfully, all my music festivals have not destroyed my hearing. We moved next door for my ultrasounds, and they did ultrasounds of everything. I'm talking my carotid arteries, thyroid, my breasts, my entire abdomen, including my liver, kidneys, gallbladder, and even my uterus, so they were very thorough here. After a packed morning, they let me sit and enjoy some lunch and coffee. Not gonna lie, that coffee hit. We went right back at it with a DEXA scan to check for bone density and body composition, followed by a mammogram, which was not as much fun. From there, we wrapped up testing and went upstairs for a 90-minute review with a nutritionist, physical therapist, and physician. We got all of the lab results same day, reviewed everything, and built a game plan for my nutrition, movement, and even supplements. They even gave me an 80-page book with all of my results and plan. This experience was unbelievable, and I'll definitely be returning.
The longer that I live abroad, the more I realize that the U.S. does not care about us. They don't care about their people at all. And it baffles me, the quality of healthcare abroad compared to the amount of money that we have to spend for healthcare in the U.S. It just doesn't make sense. Earlier this week, I went to get a full body checkup in Korea. Mind you, I've lived abroad for about 5 years. And when I went back to the U.S. last summer, I didn't go to a doctor properly for about the 5 years that I lived abroad. I just didn't go to the doctor. So when I went back to the U.S., I was like, okay, let me go see my primary physician, and I want to go get a checkup. I want to get a full body checkup because I just want to see the condition of my body. So I went back and I asked for full body checkup. Girl, I went there. He asked me some questions. They took a blood test. He listened to my heartbeat with the little thing. He said, you look healthy. And I said, yeah, that's it. Like, I have this concern, this concern, this concern. I haven't seen the doctor in 5 years. Like, I want to get properly checked because I'm here in the U.S. now, so I want to get everything done while I'm here. And he was like, yeah, but you look healthy. You're not overweight. Your heartbeat sounds good. We'll do some basic blood tests, but overall, you look healthy. And I was like, I was literally stunned. I was literally like, that's it? Like, that's it? Like, I haven't been to a doctor in 5 years and that's all you're gonna do? He was like, well, you're young and you don't have any like noticeable concerns about you, so there's nothing more we can do for you. You appear to be fine. And I was like, okay. Like, oh, it just blows my mind. So anyways, I came to Korea and I went to get a full body checkup because I've seen that they go into more depth for the body checkup. So I'm gonna read you because I forgot. I just asked for like a full body checkup package, and let me tell you what was included in that full body checkup automatically. Body examination and a composition analysis, cardiovascular examination, blood cell test, thyroid function test, a hormone test, pap smear, electrolyte panel, and cardiovascular risk test, and other tests that help understand my body's stress levels, digestions, and energy levels. And that wasn't even the top premium package that was available. That was just one of the like basic body checkup packages. Are you listening? Like, are you kidding me? So I went there, and let me tell you, I was blown away by the service that they gave me and the amount of efficiency that everything had and how organized and everything was. First of all, checked in, and then when you check in, they give you a wristband. So every time that you take a test, because they have rooms for each test. So you go up to the room, you click your wristband that they give you, and your information is already tied to it. So your name pops up on the screen that you're in that room for the test. You go in with the doctors or the nurses, whoever's in the room. They take the test for you, they do the exam that you came in to do. You go out, and then someone's outside waiting for you, and they're saying, okay, please go to room number 26. That's where you have the next examination. Go there, tap the wristband, test done immediately. Not to mention, oh my God, I did an electrolyte cardiovascular test for my heart health. Then I took my blood pressure, and then I did a urine test. Then after I was done with that, they gave me a packet, medical history questionnaire. Right? Because I've never been. So they asked about my medical history, they asked about my family history, and it was a packet full of like 9 pages filling out all my medical history. And I was just thinking, I was like, wait a second, like in the US, they never done ask me none of that. Actually, when I went back to the US to do my checkup, they didn't ask about my medical history. They didn't ask if I had any concerns. There was nothing. After I finished filling out the packet, I went to go see a doctor, and I talked to the doctor one-on-one, and the doctor spoke fluent English. I'm having consultation with the doctor, and she's going through everything with me that I just filled out in the questionnaire, but in person, and she's asking me in more details about my medical history and any concerns that I had. And I was thinking, wow, the US could never. Like, I really felt like they actually cared about my health. So I went there, I talked to her, and she was okay, do you have any family history of this, that, and the other? Who was it? And then at the end, she said, okay, do you have any other concerns that you're worried about medically? And I said, yeah, actually, I'm concerned about this and that, and would like to get checked up on it. And then she was like, okay. She's like, well, typically you're not the age range for it, but if you're concerned about it, we'll do a test. And then she was like, have you ever got tested for this and this? Because it runs in my family history. I said, no, I've never. She's like, okay, well, do you want to get those tests added today? And I was like, yeah, I do. She's like, okay, you've never got tested for it? I said, no. And she's like, okay, don't worry, we'll add it on if you want to, only if you want to. Only if I want to. And then she proceeded to say, if I added it, it would only be extra like $10 to do the test. What? And I was like, yeah, I want to get tested for it because I've been concerned about this for a while. She's like, okay. So she added to my little chart or whatever. And she's like, okay, thank you. Go outside and they'll tell you where to go next. Like I said, there's people waiting for you at every step. So I come outside and I was like, okay, here you go. And she's like, okay, you're going to go to room 13. Go to room 13, boom, check my little wristband, and proceed to get the test that I asked for. Everyone was so efficient, and everyone was so nice, and everyone was so thorough. And I also did a CT scan. I did a CT scan. I've never done a CT scan in the US, never. Like in the US, that would have costed a fortune. But no, it was just a part of the package. This wasn't even the add-on. This was a part of the package. The CT scan was a part of the package. After I finished all my tests, they were like, okay, you finished all your medical exams for today. Please go back to the locker room, get changed, and come back out. They gave everyone some clothes to wear. They're like, okay, please head upstairs to turn in your wristband. Back upstairs to where I checked in the first place. I gave back my wristband. I had to like settle the payment. They were like, okay, thank you so much for coming to us today. We hope you enjoyed our services. Then they proceeded to give me a food coupon and a drink coupon to thank me. What? And then on top of that, the cafe was attached to the hospital. So as soon as I turned in my thing, settled my payment, I gave my wristband back. They're like, okay, please proceed to the cafe, which is just down the hall. I walk in the cafeteria, I give my little coupon, free. I got my little snack and I got my little drink for free. The US could never. I don't know, I'm so shocked by how much they cared. Also, I forgot to mention that when I was checking out and like turning my wristband, they also said, okay, would you like to receive your results through email or mail? So I said email, and they said, okay, do you want it in English? And I was like, yes. So in 2 weeks' time, they're gonna send me a result of all of my medical exams and all my information and tests through email in English. Now, this is the cherry on top, because do you wanna know how long this entire process took? So from the moment that I arrived, right, to the moment that I walked out of the hospital, including my waiting time, talking to the check-in desk, waiting between each test, talking to the doctor, and changing into my clothes. Do you want to know how long this whole process took to get all of these exams done? An hour and a half. 1 hour and 30 minutes. From the time I walked in to the time I walked out. 1 hour and 30 minutes. I feel like you could wait in the US for an hour and 30 minutes just to get seen for a doctor, to talk to them for 5 minutes, for them to like basically blow you off and not care about your medical concerns. An hour and 30 minutes? I'm sorry, I'm just I'm so amazed and astonished. And then to add the 2 chairs on top, later in that afternoon, they texted me saying, we hope you enjoyed our services today. Please fill out this questionnaire to rate your experience and like tell us any feedback that you have, if there's anything we can improve. They even asked me what they could improve in a survey about it. When the US doesn't give 2 flying the US doesn't care about their service or what they're doing for their people. And I was so shocked. I said, they were already so efficient, so professional, so helpful, so kind and amazing. And then they're even asking me to give more feedback on their services and my experience. Like, I really felt cared for. I was just sitting there after receiving that text message, and I was like, wow, the US doesn't care about us. The US don't care about us at all. They're not concerned about my health the way I'm concerned about my health. And that was my experience overall with High Medi. Holy grail. Thank you. Thank you. Because I feel like now someone finally cares about my health. They have concierges, they have consultation services, they make sure that there's English interpreters and English staff working so that you can feel comfortable. Like, it's just amazing. If you need to get a checkup, go get one. Honestly, it probably would cost cheaper for you to get on a plane, fly to Korea, get all your medical treatments and hell, some beauty services, and then fly back. And it probably would be cheaper than what it costs in the US. And that's just sad. Sad.
7 minutes. In the United States, when you go see a doctor, the insurance pays them according to how quickly they get patients in and out. That's about 7 minutes max. I'm in Thailand right now, and yesterday I saw 4 doctors. 4 doctors. I probably will never go and see a doctor in the United States again. I came here specifically to do a health checkup. I saw somebody on here that said they went to Thailand, Bangkok, so that they could get a health checkup, and it was like $400-500, and they got all these things tested. Last time I was in California in June, I asked, can y'all test my vitamin B levels? And they looked at me like I had 2 horns. Oh my God, we can't do that. Oh, we have to see if we can get approval. Oh my God, we'll see if what the doctor says. And I was like, okay, whatever. And then I saw this guy in Thailand showing how he went to the hospital here and got all these things done for $400. I was like, okay, that's what I need. So I got here. Yesterday was my appointment. I got there at 8:30 a.m. They gave me a hospital robe. I take that back. They gave me a hospital uniform. They gave me a locker to put my stuff in, and they proceeded to check every single thing. They checked my blood. They checked my hormone levels. They checked my eyes. They checked my ears. They did an EKG. They did a stress test. They did a mammogram. They did a EEG, something different. They did... Oh, okay. What else did they do? I mean, I got like 20 tests done. Then they gave me money to go have lunch, so that when I came back after lunch, they had the results ready, the ones that could be done in that period of time. So I sat down with a doctor, and she went through my entire 20-page report saying, this is good, this is good, this is good, work on this, this is good, this is good, this is good, work on that. And then she said, also you get for free that you can come back tomorrow and speak to another doctor about your hormone levels. And I was like, is it possible I could get that done today? She said, hold on, let me see. Do you know that they found a doctor and I was able to get in on his schedule?
All right, thank you.
I went in, sat with him. He probably sat with me for a good 20, maybe 30 minutes, going through the report in terms of my hormone levels. Bet. Then I went back to where I was before, and mind you, everything was professionalism off top. Let me just say that. Because you know how in America, when you walk up to the counter, they looking at you all salty and crazy and like you bothering them. Baby, there was none of that at this Bangkok hospital. They were professional to a T. Oh, it felt so good to have somebody literally caring about you and if you're okay and how everything is going with you. Again, I did over 20 tests, and every time I sat down from one test, literally within 3 minutes, there was another nurse saying, hey, Miss Kelly, you ready for your next test? And she escorted me to the next one. And then when I finished with that one, she went back to the little waiting area, and literally 2-3 minutes later, another nurse, Miss Kelly, you ready for your next test? It was absolutely phenomenal. And then here's the part. The doc, after I came back from lunch, The doctor that went through the 20-page report and told me everything, and I asked her if I could see another dentist, because I did see a dentist like 4 days ago, and that went great as well. But anyway, back to this one. Then, after I finished with the doctor that helped me with understand the hormone levels with everything, then I asked them, hey, can I see someone about my throat? Because I've been having issues with my throat. And they were like, okay, well, let's see if we can find another doctor. Now, I was content with, I'm going to be here for another 4 or 5 days. I was content with finding a doctor in 2 or 3 days. Do you know, they found a doctor and put me in on his schedule. And I was able to go see a doctor. And mind you, I've had problems with my throat for 2 years. Yeah, 2 years, okay? Left side of throat, same problem. It comes and goes, it comes and goes. This doctor listened to me, because I told him, I said, you're the 10th doctor I've come to about this. He listened to me and then gave me an idea, or he came up with an idea of what he thought was wrong. I think it's called trigeminal neuralgia. So he thinks that's what it could be. I saw 4 doctors yesterday, 2 of whom were on the spot, as in I didn't plan, as in I didn't have an appointment for, as in they made sure I was able to see a professional about the things I asked for. And I scheduled this whole thing of coming to Thailand so I can have a complete medical examination from head to toe. I scheduled that 3 weeks before I came. Y'all know in the United States, when we make an appointment, we got to make an appointment 2 months out to see a doctor about something that's happening with us right now. Y'all, I saw 4 doctors yesterday. And one of them was built into the checkup because she was a lady that did the doctor that did the pap smear on me. So there were 2 doctors that were included, okay? One to give me all the results, and then the lady with the pap smear, she was a doctor as well. But 2 doctors, unplanned. And every time I went for both of those doctors, I probably waited in their lobby 8 minutes. I waited in their lobby 8 minutes or less to see the doctor that I didn't have an appointment to see. And the doctors listened to what I had, the issue going on, didn't try to usher me out after 7 minutes because insurance is only going to pay you that. They listened to me, tried to understand what was going on, and then gave me actual concrete things of what could possibly be the issue and how I could fix it. I'm never going to a doctor in the United States again, because all they're going to see is my brown skin, and they're going to try to treat me according to what they think. I've been to too many. I went to 10 doctors to see about my throat. 9. Let me take that back. 8, because one was in Puerto Rico. If you want to get taken care of in terms of your health, if you want to be listened to, specifically as a black woman, you might want to get on a plane and come to Thailand, because they're going to take care of you. They're going to make sure all of your needs are met. Y'all, I'm going to say it again. I saw 4 doctors in one day, 2 of which were not on the schedule. It's different out here.
Please like, subscribe, share, and drop a comment below on what's going on. I'll see you on the next one.